Adductor magnus.
That's from the ischiotuberosity and comes down to the adductor tubercle.
Adductor longus and brevis.
Those are from the pubic symphysis to the medial 1/3 of the femur.
Pectineus.
That comes right through here.
ASIS.
So your top of your hips right here.
Sartorius.
Sartorius comes off the ASIS and comes down and inserts on the Pesian's ring.
Rectus femoris.
It's a big long one right here.
Iliac crusts.
Those are at the very, very top of your hips, so right in here.
Gluteus medius.
That's on the middle, or it's like on more on the lateral side, so it's right in here.
Tensor fascia lata.
That comes down right in through here and attaches to the IT band.
IT band.
Which comes right down here and inserts on Gardy's tubercle.
Greater trochanter.
That is on this side, this bone right here.
Trochanteric bursa.
That's between the skin and the greater trochanter.
Sacral crest.
That is here. Can you see it?
I think. Leave it.
Right in here.
Yeah.
Okay.
PSIS.
Those are like your dimples right in here.
Gluteus maximus.
That's the big butt muscle right here.
Ischial tuberosity.
That's deep, it's your butt bone.
Sciatic nerve.
That's in between your ischial tuberosity and your greater trochanter, so right in through here.
Hamstring muscle group.
That's right here, the lateral is here, and the medial side is here. Now, I'm going to do active range of motion, which all of these would be compared bilaterally. The first one I'm going to do is hip flexion, but my patient would be supine. And have you bring your foot to the sky. Okay, now I'm going to have you flip on your stomach. Have you bring your foot up. I'm going to have you flip back over. I'm going to have you adduct your foot. You're going to be supine, so you're going to bring your leg out this way. And I'm going to have you that's for abduction. For adduction, you're going to bring your leg in here. Now I'm going to have you sit on the end of the table. For hip external rotation, you're going to bring your foot in here. And for hip internal rotation, you're going to bring your foot here. Now I'm going to do goniometer. So I'm going to have you supine, laying down. So I'm going to find the greater trochanter. I'm going to be here in the femur. I'm going to have my patient bring your feet up to the sky for flexion. And that's good. It's about 123. So the normal range is between 120 and 130. So now I'm going to have you flip over. Do the fulcrum's over the greater trochanter. And we're going to have the femur right in through here. So maybe bring your leg up as high as you can. That was only about 10, but it's okay because the range is 10 to 20. Now I'm going to have you your back again for hip abduction. Where the ASIS is the fulcrum. Then we're going to find the femur and follow it all the way down. So I'm going to have you bring your leg out as far as you can. It's supposed to be around 45, and it looks like it's 43, so it's almost normal. So I'm going to do hip abduction. So I'm going to have you bring your foot in as far as you can, and that should be about, it's about 29, and the normal is 30 for that. So I'm going to have you off the end of the table. Do hip external rotation. I have my fulcrum along the patella, my movement arm over there, so I'm gonna have you bring your foot inwards. And looks like it's about 49. The normal is 50, and for hip internal rotation, I'm gonna have you bring your foot out. And it looks like hers is about 43, and the normal for that is 45. I'm gonna compare all of this bilaterally. Now I'm gonna do passive range of motion. So I'm gonna have my patient supine. I'm gonna have you bring it up. This should be a firm end feel for hip flexion. And this should also be a firm end feel for hip flexion. Now I'm gonna have you flip over on your stomach. Bring this up. This should be a firm end feel for hip extension. Oh. Bring it up. And this should also be a firm end feel for hip extension. Now I'm gonna have you lay on your side for hip abduction. I'm gonna abduct my hip, and that should be a firm end feel. Now I'm gonna have you flip on the other side. For hip adduction, your foot is gonna be over, like crossing, and this is for adduction. That would be a firm end feel. And now I'm gonna have you lay on your back with your feet up, or for your knees up like this. I guess just one. And I'm going to externally rotate and internally rotate the hip. These should be firm end feels as well. Now I'm going to do my manual muscle testing. So I'm going to, for hip flexion, I'm going to have you push up. With my hand, that would be a 5 out of 5. Now I'm going to have you at the end of the table. I'm going to have you push up. For hip flexion again, that would be 5 out of 5. Now I'm going to have you bring on your stomach. For hip extension, I'm going to have you push up. That would be a 5 out of 5. I'm going to have your knee flex. For hip extension again, I'm going to push up. That'd be 5 out of 5. Now I'm gonna have you on your side. For hip abduction, have you push up. That'd be good. 5 out of 5. Now flip to the other side with your other leg crossed over. For hip adduction, have you push up. That'd be good. 5 out of 5. Now I'm gonna have you at the end of the table seated. For hip external rotation, I'm gonna have you push in. That'd be 5 out of 5. Then we push out for hip internal rotation. That'd be 5 out of 5. So now I'd compare all of those bilaterally as well. So now I'm going to move on to my ligamentous and special tests. The first one I'm going to do is I'm going to have the patient on their side. I'm going to push down over the iliac crest. If there's pain with that, that could indicate a posterior SI ligament sprain. Now I'm going to have you on your back. Cross my arms. I'm going to apply a downwards and outwards pressure. So if there's pain with that, that could indicate anterior SI ligament sprain. Next one I'm going to have you do is the fulcrum test. I'm going to have you seated at the edge of the table with your thigh like midway off. I'm going to push my leg under. I'm going to press down, and if there's pain with that, then that could indicate a possible stress fracture of the femoral neck. The next one I'm going to do is the hip scoring test, which I'm going to have you with your knee bent. Apply an axial load, and I'm going to internally and externally rotate the hip. And if there's pain with that, that could indicate problems with the articular cartilage or a possible labral tear. The next one I'm going to do is the Patrick or Faber test. I'm going to have you in a figure 4 position. Put pressure downwards. If there's pain or she can't get her knee down, if it stays in this position, which it kind of is, then that could indicate tightness with the iliopsoas muscle groups. The next one I'm going to do is Ober's test. I'm going to have the patient on their side. Now I'm going to abduct and rotate outwards, and her hip should fall all the way so it's past the table, but it is not. So this would be a positive test for IT band tightness. The next one I'm going to do is Galston's or it's Galston's. I'm going to have you bring this knee flexed up, and I'm going to bring your hip backwards. If there is pain with that, that could indicate an L4 neuron lesion or impingement or SI joint problems or hip pathology. The next one I'm going to do is the Thomas and Kendall test. I'm going to have you at the end of the table. You're going to be supine with your knees up towards your chest. You're going to drop one, and if their leg was still flexed, their hip was still flexed, that would be a positive for Thomas. That could indicate iliopsoas muscle tightness. And if their leg was out like this, that would be a positive for Kendall, and that would indicate rectus femoris tightness. So I'm going to have you on your stomach prone for Ely's. I'm going to bring your leg up, And if the hip also comes up with this one, that could indicate rectus femoris tightness. Next I'm gonna have you do is Trendelenburg's. So I'm gonna find her PSISs on both sides, but it's kind of hard with holding the camera. And I'd have you stand on one leg. And if the PSIS on the non-weight bearing side drops, that could indicate gluteus medius weakness in the weight bearing hip. The last one I'm going to do is piriformis, and I'd compare all of these tests bilaterally. I'll have you scoot even further off, and I'm going to apply pressure with this one, and if there's pain, that could indicate piriformis syndrome, which is possible like sciatic nerve entrapment. Now I'm going to do the femoral nerve traction test. So I'm going to have you on your side. I'm going to have you in knee flexion, and I'm going to keep the knee flexion while extending the hip. If there is pain with that, or paresthesia, that could indicate problems with the L2, L3, or L4 nerves. Now I'm going to do the hamstrings tendon reflex. Possibly flex. Can you see it?
Yeah.
Okay. So on the lateral side, I don't know. My patient doesn't have good hamstring reflexes. And then on the medial side, okay, so for the lateral testing, the lateral hamstring, that would be testing the the S1 and S2. And if it was the medial hamstrings, it would be testing the L5 and S1. And if both of them didn't fire, that would be bilateral. That would indicate an upper motor neuron lesion. And if it was unilateral, it would indicate a lower motor neuron lesion. The last thing I'm going to do is I'm going to do the myotomes and dermatomes and reflexes. So the myotomes for L1 and L2, my patient would be supine, and they would bring their leg up towards the sky for hip flexion for both S1 or L1 and L2. For L3, they're going to be off the edge of the table. They're going to extend their knee. L4 would be ankle dorsiflexion. They're going to bring their leg up. L5 would be great toe extension, so they're going to bring their great toe up the sky. S1 is ankle plantar flexion, so you're going to press like you're on a gas pedal. And S2 would be knee flexion, so you're going to bring their knee up. Now I'm going to do my reflexes. So L1 doesn't have a reflex, but L2 through L5 is the patellar tendon. So there we go. For L2, 3, 4, and 5, and then S1 and S2 is the Achilles tendon reflex. There we go. And now for dermatomes. So L1, I'm gonna have my patient close their eyes. I'd ask them if it was sharp or dull. L1 is like the high groin area, so it's right in here, so I'd ask them sharp or dull, sharp or dull. L2 is lower groin, so I'd ask them sharp or dull with their eyes closed. And then L3 is the mid thigh, so I'd ask them sharp or dull, sharp or dull. L4 is the patella, so I'd ask them sharp, dull, sharp, dull. The L5 is like the medial tibia, so I'd ask them sharp or dull, sharp or dull. S1 is the lateral hamstrings, so I'd ask them sharp or dull, and then S2 is the medial hamstrings, so I'd ask them sharp or dull, sharp or dull.